Hello and welcome to another Tuesdays with Liz, a disability policy for all. Today we are starting a three-part series on healthcare and disability. I'm happy to have my guest Bethany Lilly from the Bazelon Center for Mental Health Law. So welcome, Bethany.
Thanks, Liz. I'm glad to be here.
The first question is, we have been hearing a lot about health care and Patient Protection and Affordable Care Act, also known as the Obamacare Act. Can you tell us what some of the important parts of the law are for people with disabilities?
Sure, I'd be happy to. And it's a really big law, so I'm not going to be able to hit on everything. But I think for folks with disabilities, some of the most important pieces are around getting access to insurance. So that would be the Medicaid expansion and the healthcare subsidies that help people between who don't make a lot of money pay for their health insurance. The other one would be the expansion of services for kids. So if you are a young person, you can stay on your parents' insurance until you're 26. The other major provisions were around non-discrimination. And these are particularly important for folks with disabilities because, first off, 1557 applied the ADA to a lot of the healthcare system. And then we also instituted two different bans on how health insurance works. The first one was to say you cannot discriminate against people with pre-existing conditions. So if you are a person with disability now in the United States, you can buy any health insurance plan you want if you have enough money for it and are eligible and all that. But your disability is not a basis for you not to get health insurance. And the second one was to tell insurance companies that they couldn't cut people off after they'd used a certain amount of insurance, so we got rid of annual and lifetime limits. And we also got rid of health insurance companies being able to charge you more just because you have a disability or a health condition.
Okay, thank you. What would happen for people with disability if those parts of the law were taken away?
Well, I think one of the major things that would happen is that people could lose insurance. Before the Affordable Care Act, we had a lot of people who couldn't buy insurance because they had a pre-existing condition. And the Medicaid expansion has given health insurance to tons of people who don't have enough money otherwise to buy it. If you're on Medicaid, there are some exceptions, but most people on Medicaid just don't have money to buy other types of insurance. For us, at the Bazelon Center, a lot of folks with mental illness are in the Medicaid expansion population, and we're really worried that those folks might lose their health insurance.
That's very scary. People lose their.
I agree. I've been really worried about it myself, and I know I have a couple of friends who are equally as worried about it. I mean, health insurance in a lot of ways is that safety net. It makes sure that you know that if anything happens, you can get it taken care of. And yeah.
I know some of the people in Congress and the president want to replace the health care law. Why? And what do they want to replace it with?
Well, I think there are a couple different arguments. One of them would be that, certain people don't think that the government should be involved in health insurance. Some people think the Affordable Care Act isn't working very well, that people are paying too much money for their health insurance, and some people think that there might be a better way to do it. There have been a couple of different proposals. Speaker Paul Ryan has one, and the nominee that President-elect Trump nominated for the Department of Health and Human Services has another idea. I think for people with disabilities, there are some questions about how those plans would work, because a lot of them repeal the Medicaid expansion that we talked about, and I know that Representative Price's plan doesn't include a ban on the pre-existing condition ban. And I think those aspects really concern me, and I think we'll have to see. I think there are a lot of question marks about what a replacement would look like. So I don't know.
Thank you. Is there anything else that you would like to tell us about what's happening with the ACA now?
I think that, folks who have ACA coverage should be talking about how really important it is for them. When I was out of a job, the ACA made sure that I could buy health insurance, and that was really nice. And I think for a lot of folks, the ACA is, like health insurance generally, kind of that, safety net. So I think just, talk about it and talk about how important it is to you.
Thank you so much, Bethany. Again, this is the first of 3 parts of Tuesdays with Liz about healthcare. Next week we will be talking with Stephanie Merritt from Georgia about how healthcare is important to her and her family. And if you have any questions about this or any other policy issues, please go to the AGCG webpage and look for this week's In Brief. And if you have any questions or comments about this edition of Tuesdays with Liz, please leave them in the space below. Thanks again, Bethany.
Thank you, Liz. It's been great talking to you.
Bye.